Pregnancy test: when is the best time to take it and which one, urine or blood? Pregnancy and conception come with their own set of challenges and tribulations. One of it is deciding and knowing when to take the pregnancy test. While a false negative test result when you're expecting might dampen your spirits, but a false positive test when you least expect it might send you into nervous jitters. Hence, it is absolutely necessary to analyze when is the perfect time to take the test and how. What's been tested in a pregnancy test? Our female body is designed in such a way that as soon as the fertilized egg gets attached to the uterine walls and linings, a special type of hormone called HCG, human chorionic gonadotrophin, forms a part of our urine and is secreted every time we pee. The home pregnancy test kits basically show you whether or not HCG is present in your urine. While most people take the home pregnancy test, many prefer going to the doctor to get the results. In most cases, a gynecologist would ask you to go for a blood test to check for pregnancy as it is considered to be more accurate. When is the perfect time to take the test? Now, many people don't know the correct answer to this and end up taking the tests at a time when the results are bound to be incorrect. Hence, read the details carefully to know when it is the best time to take the test. Never take the test a few days before your periods as it would never give you an accurate result. Never take the test on the first day of your missed period as again, it would not always be accurate. If you have a regular cycle, take the test 2-3 days post you miss your menstrual date, as this would be the best time to get the answer. Take the test the first time you pee in the morning as your urine would be concentrated during this time. Don't drink a lot of water/juice/shakes and then take the test as it would dilute your urine and it would not be as concentrated as you'd want it to be. Symptoms when one should take the test. If you have not been expecting a pregnancy but have regular intercourse and face these symptoms, it is time to take the test. If you get a sudden feeling of nerves and muscles being pulled towards the lower end of your pelvic area when you get up or stand up after sitting. If you see few drops of blood while going to the loo or even otherwise, a few days before your next period. If you feel that your stomach is bloated at all times. If your breasts appear to be extra sensitive to any kind of touch and feel. If you feel minor pain in your breasts or they appear to be too tender. If you're otherwise an active person and suddenly start feeling fatigued and worn out easily, it's probably time for you to take the test. It could be the smell coming out of your kitchen or from your surroundings. Nausea and a sudden feeling of giddiness. Strange food cravings is another way of telling you're pregnant. You might feel like having something you have never had before, or might feel like throwing up once you have had something you could perhaps eat 1,000,000 times a day, earlier. If you suddenly start feeling too hungry at all times. A weird taste in your mouth which might make you want to puke. A slight constipation. In some cases, women also undergo slight loose motions during the first trimester of the pregnancy. Last but not the least, vaginal discharge. Urine pregnancy tests. These days more and more women take the home pregnancy test to ascertain whether they're pregnant or not. Not only is it discreet and can be done anywhere, but also gives an accurate result if taken at the right time. And the best part is that the results are in your hand within a few minutes of taking the test. How to take the test. Take the test the first time you pass urine in the morning. Collect your urine using a dropper. Drop 1-2 drops of urine on the kit which is marked for the sample. Don't move the kit too much. Place it gently on the floor. Don't add water or more urine to it. Wait for a few minutes. If you see 2 pink lines appear on the kit, it's a positive result, which means you are carrying. If you see only 1 pink link, it means your test is negative and you are not carrying yet. If you see a proper and a half line or any other form of lines apart from the first 2, it means your test results were not accurate. You should take the test once more in that case. If tested positive, you must visit your gynecologist to get a thorough checkup done to understand the stage and development of your embryo. False positive pregnancy test result. In rare cases, pregnancy tests might give a positive result but are not accurate. The reason behind this could be many. Many women see a surge in their HCG levels during their premenopausal days. If you are on some strong pills and drugs like antidepressants etc., if your urine contains blood or protein, HCG might be released from your pituitary gland. Those undergoing artificial methods of reproduction have more chances of getting wrong test results. False negative pregnancy test result. There are many reasons why you might get a false negative pregnancy test result. Some of them are: if the test is taken at the wrong time of the day, if the test is taken too early before the next period, expired test kit. Consume too much of fluid before taking the test. If you are on strong medication, blood test. There is no doubt about the fact that blood tests are much more accurate than urine tests. Blood tests can detect pregnancy or HCG levels in your blood sample within 6–10 days of conception. However, the results take a day or two's time to come. One. When is the best time to take a pregnancy test, morning or night? It is said that the best time to take a pregnancy test at home is morning. It should be the first thing to do in the morning when you wake up, with the first urine in the morning. It is also recommended not to pee at night and then do the test as soon as you get up in the morning. Not going to the washroom at night actually allows the HCG level to be higher and easily detected. Although doing the tests in the afternoon has also shown positive results, but it is recommended to do test the first thing after you get up in the morning. Two. When to take a pregnancy test after a missed period. For the most accurate results, it is recommended to wait until the week after you have missed your periods. Or else, if you don't want to wait until you miss your monthly cycle, do the test after waiting for at least 1 to 2 weeks after you have had sex. If you are pregnant, your body would take some time to detect the levels of HCG. And this usually takes 7 to 12 days after positive implantation of an egg. Three. When to take a pregnancy test with irregular periods. In case you're having irregular periods, start counting 36 days from the last start of your periods or 4 weeks from the last time you had sex. In case you're pregnant, this is the best time and enough where your HCG levels would be detected. If you are having frequent unprotected intercourse and feel that you might be pregnant, opt for a home urine test and take it up with your doctor next, if it comes positive. Good luck!